Leslie joins us with more. So you did an investigation on ketamine clinics 2 years ago. I remember that well. So tell us, what has changed in the last 2 years?
Ketamine therapy is rapidly evolving in a really good way. Like you said, 2 years ago, when I visited these ketamine clinics, you get an IV in your arm and they send you on your way. They're very expensive, these treatments, and I felt like a lot of these places were really looking to cash in on people versus caring more about their mental health, which is what the treatment should be about. And now we're seeing this shift, like you saw with Field Trip Health. You have a therapist right by your side to unpack your experience afterwards. You're not just going home and processing everything by yourself. And so a lot has changed, I think, for the better.
I agree. So what other ways is ketamine therapy evolving?
Well, let's talk about the price. It's definitely gone down a lot in price because of the demand, but also because now you can administer ketamine by pills. You can also get a shot like they do at Field Trip Health, so you're not getting an IV in your arm to get the same kind of results. And let's talk about setting. Field Trip Health is just an example. These new ketamine clinics are popping up that are inviting. It's set in setting. It's not stark and very medicinal like this. It's more inviting, and so you feel relaxed. And a really big change in ketamine therapy is this virtual element where you can actually download an app, fill out an intake, have a virtual guide, have the ketamine sent to your home, and do all of this in the comfort of your own home. And it's completely legal. Because as you know, ketamine is FDA approved as an anesthetic, and it's being used off-label, and it's being prescribed by licensed physicians, so it's legal.
So I guess what you're saying with the at-home version, that you get a prescription for your ketamine. In that case, it's going to be administered by mouth, which you can do similar to other medications. And I guess that they walk you through what they want you to experience. But I think it's a game changer, the fact they're doing it now in a setting where you're calm, relaxed. And I mean, think about it, dealing with any mental health issue or emotional issue, that if just calming you down with your surroundings is a step in the right direction.
But this is all under the guidance of a physician or a clinician.
In a setting where you go in to get the treatment, yes, you are being watched heavily. They're actually sitting right by you in a lot of these places as you unpack your experience. You're doing it by yourself. You're doing the work by yourself, which is how psychedelics really work. It's doing it alone. But afterwards, you unpack your experience right after, where you have the strongest memories.